What up, fellas? It's Ty. Welcome back to the channel where we discuss all things prostate and prostate cancer related. If you're new here, welcome to you. If you've been here, watched the video, maybe even liked and subscribed, I appreciate you. So we're going to get right into it today. I want to talk to you about something that that happens to me. And then I'm thinking that maybe it happens to some of you. And I just want you to know that you're not alone. So one of the things I want to talk to you about is pre-diagnosis of prostate cancer and then after the radical prostatectomy. It kind of goes together. So when you first get diagnosed with prostate cancer, they do the biopsy, and then you have to wait. And then you have to go in and find out whether or not you have prostate cancer. And so I know that was difficult for you all because it was difficult for me. And so I was waiting, and then I went in and I sat there, and then he came in, he put his head down, told me he found something. And so that moment kind of stains you like in your soul, right? And so you hope that you would never have to go through that moment again. But I'm here to tell you guys that you do have to go through that moment again. And it's unfortunate because you have to go through it again and again and again. Well, what do you mean, Ty? Well, I'm going to tell you. Here's the thing. After your radical prostatectomy, you're going to be placed on intervals based on whatever it is your doctor wants to see you every 3 months, every 6 months, every 12 months, or whatever it is that you guys have come up with. And he's going to check your PSA. You're going to go in, you're going to get your blood drawn, then check your PSA to make sure it's under 1. And the thing is that when you first think about this, right? For me, a couple of days before my appointments, I'm a little antsy, I'm a little irritable. On the drive over, a year and a half later almost, I still have some anxiety, and I'm driving there all the way through, checking and getting my blood drawn and sitting in the room waiting for my doctor to come in and tell me that my PSA says 000 point something. And although I am, prior to having an appointment, I'm feeling great, I'm doing fine, whenever that appointment's coming, I feel a lot of anxiety. And I was like, where, it seemed familiar. I'm like, that's the same anxiety I had when I was waiting to find out if I had prostate cancer. And I'm doing this every 3 months. So I'm letting you all know that if you have not had the radical prostatectomy, that's going to be your reality, and that maybe if you've had it already, that if you're going through that, and maybe you don't have anything, and that is great. But for me, I don't know. I just remember how I felt about that when he said yes, and I never wanted to feel that way again. And so having to go in there and sit there and have that test done and waiting, and it's so crazy, guys. I do a urinalysis while I'm there, and then I have my PSA, my blood drawn, and then I'm sitting and waiting, and then my appointment takes about 2 minutes. Like, hey, come in, tell me that this and this. He didn't find anything in the urinalysis to make sure I didn't have anything that was going on with, bacterial infections or anything like that. And then I leave, right? And then I walk out, and so, some of your experiences, I just want you to know that I'm going through this as well. And, it gets better. Like you actually, the drive doesn't seem as long. How about that? But anyway, I just wanted to let you guys know that, because if you've just had your if you just had your radical prostatectomy, it's very important that I let you know that, because you may not know that, and you need to know that feeling is coming so that you can deal with it and prepare. All right? As always, I hope this finds you well. Peace and blessings, fellas.